See, India as a whole, if you see in the Indian population, the prevalence of such is quite high. It is not only because of the population pattern, but also due to some certain characteristic, like there is some malnutrition going on in India. Also, the societal norms, which hopefully nowadays they are getting corrected, but still you can see a lot of early marriages, early child births. Those are actually contributing to a lot of problems with the bone and joints, especially of the female population. So now, over a period of time, what I have seen and we have observed also, that there is somehow the increased awareness of the issues, and also people are getting more aware, so the diagnosis is more. Nowadays we have got newer technologies coming into the play. Also those technologies are getting more accessible to the not only the urban areas, but also the semi-urban and the rural areas. So definitely the diagnosing part is improving, and side by side, due to the increase in the number of medical professionals plus the medical facilities all over India, so we are seeing quite a good number of treatment procedures also being performed on the patients. Particularly for the younger professionals, I would say, due to the lack of time, they may not have all the facilities available. So definitely what simple things they can try. For example, if you are in a desk job, suppose, then I always advise my patients ki, okay, don't sit for a longer period of time. After every say 10 or 15 minutes, just go for a 1 minute walk, 5 minutes walk. Then wherever possible, you may try to walk, maybe few distances there, let's say 100 meters, 200 meters, or maybe even half a kilometer. You just try to walk rather than taking a maybe cab or bike. It is inside maybe within walkable distance. Secondly, diet part, if you see, diet part, you can slowly avoid those products which are actually harming you. For example, number one product that I can definitely mention is sugar. Sugar is, you may be aware, it's an acquired taste. If you stop having sugar for 30 days, you will never even try to have sugar. But that 30 days is important. So likewise, oily foods, and any food you try to take it in moderation. And lastly, maybe try to avoid any kind of addictions, mostly, whether it's smoking or alcohol. Those really mess up our system a lot. See, there are two aspects basically. If you are already deficient, then unless and until you correct the deficiency, it is not going to go away. So deficiency may be due to either you are taking it less, or maybe in some elderly population, what happens that even if you want to take that food, it is not getting absorbed. So ultimately you are getting those things are deficient in your body. So definitely you have to take those supplements or nutraceuticals, whichever way you want to frame it. Secondly, those nutraceuticals, most of them are quite safe compared to normal medicines, the way we think of the medicine. So compared to medicines per se, the nutraceuticals, their safety profile is much improved. So for a prolonged period also, if you take, it is not going to do much harm to you. In fact, they are quite harmless also. But definitely what you can do, unless there is a real deficiency or like you are taking in a prophylactic way, you can take it for a certain amount of time, and then maybe after a certain amount of time, you can stop that for a particular interval. Then again, you start after say 3 weeks, 6 weeks or 6 months, like that.